At the private therapy clinic, we provide an assessment to diagnose dyslexia, or as we call it nowadays, specific learning disorder with impairment in reading. This is important to note because dyslexia is an old term, and right now we're talking about specific learning disabilities. So what do we do to diagnose dyslexia? We use high profile tests to diagnose dyslexia. That means that we need more than one session to make the diagnosis because the tests are quite lengthy in itself, and they give us a lot of information about the way that you think and the way that you explore your thoughts and your way of reasoning. So the first part of the dyslexia assessment, it's important for you to come at the earliest slot in the morning, because it's when we test for your cognitive ability. Your cognitive ability has a lot to do with your verbal and non-verbal ability to reason and not reason words, and to test your working memory. Then we have a second part of the assessment that is done on a second day. It doesn't matter how far away the second part takes place, but it has to take place also in a morning slot. That means that we need to make sure that your cognitive ability is still very awakened to do the achievement test. In this achievement test, it's where we actually measure the learning disabilities. So for example, we measure your oral ability, your language ability, your math ability. Now, why do we measure math? And this is a specific good question. We measure math because sometimes people with dyslexia will also face difficulties with numbers. So that way we can measure dyscalculia, which will be a difficulty with numbers. We also obtain a coefficient of your reading fluency and speaking fluency, and that completes the second part of the assessment. So we have a first part that tests your cognitive ability, and a second part that tests your achievement ability. And when we make a diagnosis, both things go hand in hand. Your working memory, which is tested on the first day of the diagnosis, has a lot to do with your achievement. That's why we do the two assessments at the same time. So after you've been diagnosed with dyslexia, we will produce a report that will be handed to you. This report will contain the results of your assessment, both of the cognitive assessment and the achievement assessment. It will contain graphs so that you can see a little bit more where you fall in the range, and then it will contain also a part of recommendations. The recommendations will vary depending on your needs. However, most of the time you may need extra time to complete tasks. You may need a different space to work, so you might need to be isolated during exams. You may need to go to therapy to learn how to manage any anxieties that come around this, especially with children. When they struggle to read and learn, they become quite anxious, so they need a little bit more of time. So we explain to the teachers that giving them extra time is essential so that they can actually achieve higher. Needing extra time doesn't mean that you are not going to achieve a better level. It just means that you're achieving a better level by having a little bit more of time to process and to do the tasks. So the treatments available are cognitive behavioral therapy to help you to manage your own anxieties and that of your child, if in case you are assessing a child, and extra time, which is also essential to any person who is diagnosed with dyslexia. How much extra time? It depends on what purpose it has. So for people who go to universities, I think there's a bracket between 25 and 50% more of extra time. So that's important for you to know that you will always get extra time, because you're entitled to by the NHS to get extra time for any specific learning disability.